I'm Dr. Jerry Mixon from Longevity Medical Clinic, and today we're going to be talking about rapamycin. I'm sure that if you're interested in longevity or, quote, anti-aging, this is a drug you've probably heard of. This drug has been approved for human use since the 1990s, so it's got about 25 years of approved FDA use, and actually it's been used for people for probably 5 years beyond that. It's the only drug we have ever found that increases the lifespan in every creature in whom it has ever been tried. Now that's amazing. Worms, flies, mice, rats, dogs, primates, and we believe people will probably get the same effect. Now the reason I say people, we think, because a long enough, large enough study has not been done on people. We live a long time. Mice live an average of about 25 months. So doing a mice study, if we can make them go from 25 to 30 months, well, you've had a 20% increase in lifespan. People live on average of late 70s to 80 years. It takes a lot of people for a long time on the drug for us to really get a statistically significant number. Nevertheless, every marker that goes with increased lifespan has been shown to be improved in people that are on rapamycin. So we strongly suspect, in fact, most of us fervently believe, that it will turn out to be a life-extending, health-extending compound for human beings. And that's why virtually every competent researcher in longevity on the planet is using rapamycin themselves. Now, they may or may not write it for their patients, but they take it themselves. They also take it in usually somewhat higher doses than we recommend for our patients. And I've talked about this on my radio show from time to time, and people say, well, you admit that you sometimes take higher doses than you give us. Why is that? And the reason is simple. If I do something stupid and hurt me, I won't sue me, right? If I do something stupid and hurt you, well, you're going to have a friendly lawyer who wants to get rich off me. So reality is most doctors are very conservative with their doses of rapamycin, and I suspect too conservative. What we found in our studies is that the lifespan extension with rapamycin is directly related to the amount of the drug we give them, not how often we give it to them. We seem to get the same results from once or twice a week that we get from every day, which is really kind of interesting. We've also found in animal studies that if we give it to young adults, they live as long as older animals that get it every day. Again, counterintuitive, but it seems to be the truth. So most of the people that take rapamycin take once a week. I usually take it once a week, although occasionally I admit I've gone to every 4 or 5 days. The most common dose is 4 to 6 milligrams per week in a single dose. I have at times pushed my own up to 16, 18 milligrams in a week with no apparent adverse effects of any kind. The proper dosing is an unknown. Usually, let's say we want to give you a blood pressure medicine for a research project. We're going to give you enough of the drug to lower your blood pressure, and we're going to accept the fact that you're going to have a fair number of side effects, and then we're going to look at the side effects, and we're going to look at the degree of blood pressure lowering we got, and we make a decision. Are the results we're getting worth the price we're paying? Rapamycin is the only drug I know of in which we are so conservative in our dosing that we're shooting for a dose that causes no adverse effects. Now, that almost violates Dr. Mixon's first rule of medicine, which is anything strong enough to help is strong enough to hurt. For us to say we're going to give you a dose that has no adverse effects at all, well, it's a standard we have not held any other medication to. But let me tell you a little bit about what we do know about this drug, and I'm freely admit we don't know what the proper dose is, and we don't know what the proper frequency of that dose should be. We've got some ideas, we've got some guesstimates, but we don't really know. This drug has been used on dogs. In the dog studies, they used a very high dose. They used a dose that, if you translated it to me, a 200-pound man, would be about 28 milligrams a week. That was about 14 milligrams twice a week, or 6 or 7 milligrams every other day. They hit the dogs pretty high, but interestingly, the dogs didn't have bad effects. They loved the stuff. They started eating better. They got frisky. They romped. They played with their masters. And when they looked at their cardiac output, they actually improved these aged hearts. So they were pumping more blood with each stroke. Fascinating. If we could improve the ventricular output in old people's hearts with 10 or 12 weeks of therapies, we ought to be doing it. But again, study hasn't been done in people yet. Somewhere there's a cardiology group brave enough to give this a try, though. It triggers new hair growth in some people, and it triggers a lot of people to get darker hair. Now, if you notice from my hair, okay, I started out blonde. I was gray in my 30s. There are no melanocytes left in my hair. So my hair is not going to get darker. There's got to be something there for the drug to work with. My wife, on the other hand, who is about 30 years my junior, she was about 3/4 gray and 1/4 dark, and we put her on the Rapamycin about a year ago, and she is now about 3/4 dark and 1/4 gray. So her younger hair that still had some melanocytes, that was gray instead of white, is getting darker. I am a 76-year-old man. I found that when I kicked up my rapamycin dose to somewhat above our usual 6 milligram per week, I started peeing like I did 20 years ago. My prostate is not impinging like it used to be. So, I mean, that's a big change for older men. Many of the men in our clinics that are only getting 6 milligrams a week are also noticing improvement. They're not reporting quite as dramatic an improvement as I had with my somewhat higher dose. It does raise blood sugars and cholesterols a bit, but it doesn't cause diabetes, and they don't get heart attacks. A fascinating thing is that, see, starvation will raise blood sugar and cholesterol. What happens is when you're not eating enough calories, you start burning the fat, and all that fat gets released into the bloodstream, and your body converts some of those lipids into glucose, into sugar, to get rid of it, burn it, and let you pee it out if you have to. So it seems that this is a pseudo-diabetes. It's not a true diabetes. This drug seems, in some respects, to emulate the physiologic changes we see with long-term fasting or calorie restriction, even though it doesn't necessarily make you eat less, but it does restore the appetite sensing to most people, which I think is kind of interesting. You know, as people get older, they lose track of how much they actually need to eat, and they start eating until their stomach is full and stretched. Well, that's far more than you really need. You know, my little 11-year-old daughter will stop eating when she's had enough, and she leaves about half the food on her plate, and used to upset her mom a bit. But now we realize, no, this is keeping her lean and fit and athletic. She is a very fierce épée fencer, and we love to see this lean, hard 11-year-old of ours out on the strip. So it seems to help restore your sense of how much food you need, rather than have you eat until you're stuffed and full. Because if you're eating until you're stuffed and full, you're eating more calories than you need, and that's one of the reasons old folks tend to get fat. Side effects from the drug? Well, as I said, sugars rise a bit, cholesterol can rise a bit. A few people will get a rash. A few people, like maybe 5 or 10%, get a mild stomatitis, or little sores on the inside of their mouth. They clear a day or two later, so they don't last long, and I've never seen one cause trouble, and it's never been bad enough that it caused the patient to stop taking the drug. Cancer is a big bugaboo. Everybody's worried about cancer. Well, all of the immunosuppressants except rapamycin do raise the risk of cancer. All of the immunomodulators we use for autoimmune diseases and rheumatoid arthritis and so on raise the risk of cancer. This one does not. In fact, the patients that have been on it for years and years at fairly high doses to suppress their transplant rejection, they get far less cancer when they're put on rapamycin. So it seems to lower the risk of breast cancer, prostate cancer, skin cancers of all kinds. So it's really fascinating. So we have an immunosuppressant / immunomodulator, because in many ways it changes your immune system to make it look as though it's younger. It actually becomes better at clearing senescent cells and worn out cells from your system. It alters our immune system, but not the way that any other immunosuppressant would do. All in all, this is a great drug. I wish we would know exactly how much of it we can tolerate. Where are the trade-offs? We'll find out over the next few years. But for right now, it is the second best approach to longevity I know of. The best approach, dasatinib and quercetin to abolish about 2/3 of your senescent cells. But we'll get to that in a different video. Rapamycin at its highest doses increases lifespan in the experimental animals about 15%. If it will increase the lifespan of humans 15%. That would be on average of 11 or 12-year extension in your health span and your lifespan. That would be really worthwhile. The number one treatment that I mentioned earlier, the senescent cell therapy, in the experimental animals did a 36% improvement in health and lifespan. We'll see if these are translated to humans in our later studies. Right now, I use them both. Thank you for watching, and keep watching. We're going to have a lot more videos for you here at Longevity Medical Clinic. Oh, and by the way, if you want to go to a clinic where the doctors do nothing but longevity, our job is to make you stronger, faster, leaner, smarter, sexier, and in the process, happier. That's what Longevity Medical Clinic is all about. So we don't do plastic surgery. We're not out to make you look like you're healthier. We want you to actually be healthier. Thank you for watching, and we'll see you in the next video.